question. Right. So if you have read and understood, considering it communication skill station, kindly begin.
Okay. Hello, Mr. Max. I'm Dr. Samreen, Mr. Roberts' senior house officer. So I have been asked to talk to you about the investigation that he would like to arrange for you. So before I start, can you tell me what you understand so far?
Yes, doctor. Mr. Robert told me that as I'm having this bleeding from my back passage, he want to look inside my bowel by a camera to see from where the bleeding is coming. But doctor, I'm very much anxious that how are you going to introduce a camera by my back passage?
Okay, so let me just tell you in detail so that you will understand. Okay. So
Okay.
this is a camera test which is called a colonoscopy, and the camera is known as the endoscope, and it's a very small 2 pence in size. This will be inserted through the passage into your large bowel, and this camera, this is going to relay some image onto the screen so that we can have a close look to your bowel and see what is causing this complication or what is causing these symptoms. And this is a very accurate way of looking into the lining of the bowel. And during this process, we are also going to take some tissue samples, which is going to help us in the diagnosis. So do you understand what I'm trying to say you?
Yes, doctor, but I don't think it will be very much comforting. So, will
Uh,
I be awake during the procedure?
Oh, normally it usually doesn't hurt, but you will be in your sense. We will be giving you some medication like sedative. So you will be awake, but you will be drowsy as well, and you wouldn't mind with the procedure, and you won't remember it clearly. Okay, and you will also be given some laxative to clear your bowel so that we can see clearly we can see your bowel clearly. All right. And
Um,
after that, during the procedure, we will be inserting some air through your back passage. You might feel a little discomfort, and you don't feel embarrassed about it. And the operator may ask you to move on your side or or on your back time to time. Okay. Do
okay,
you
but
understand me?
doctor, yes, doctor, but I actually, I'm not, as by saying, I'm very anxious that a um, camera is introducing to my back passage. Aren't there any alternative except this one?
Yes. Yes, of course, there is an alternative like barium enema. We say it barium enema. This is a contrast solution. This will be inserted through your back passage as well, and we will take X-rays of that. Will be taken, but this will not provide as much as detailed information like the endoscopic investigation, and also we cannot take any tissue sample for analysis.
So it is not
And
enough for my diagnosis, right?
Uh, since you have this condition, the since you have some problem in your change in bowel habit and you have some bleeding coming out from that region, it would be wiser to use the endoscopic procedure more than the other alternative. And
Okay, doctor.
the earlier we find out the reason for this, the earlier we can treat you.
Okay, doctor, but are there any complication?
Yes, there is no procedure without any risk, as you know, since you will be given some sedative. This may result in depressing your respiratory center. You may have bradycardia, nausea, and vomiting may also
What is
occur. May have
bradycardia, doctor?
your heart rate may uh, slow down. But if these conditions appear, you need close monitoring, and also there might be bleeding from the site of your tissues, from the site we are taking the tissue samples, but it usually stops on its own. But if that doesn't happen, then you will be treated with cauterization or any injection to that area. But this is very rare, almost 1 in 200 cases this happen. And also there might be a little bit serious condition called perforation, that tearing your bowel layer, and this usually requires an operation to treat, to repair the case. And
Oh my
this
God,
is
doctor,
also
it
quite
seems very dangerous. I don't want to do this actually.
uh,
You are saying
don't
that that
worry,
will be.
don't you worry, you are in good hands, and these are usually performed by professionals. And this is almost a very rare case, occurs in 1 in 1,000 cases. Okay, so you don't need to worry
Okay.
about it.
So
You are
what
in
will
good
be my
hands.
diet plan before the procedure?
Yes, I'll tell you that 2 days before your procedure, you will be in low diet, and you a low fiber diet, and you have to take plenty of water. And just the day before your diet, you will have to take clear fluids like black tea or coffee, and you can take clear soups and also glucose drinks. And you will also be provided with laxatives so that you can clear your bowel.
So can I take my blood pressure tablet in the morning?
Yes, of course, you can take it, your regular medications, but with sips of water only.
What about aspirin? Actually, I have a family history of heart disease, so I'm having this aspirin. Can I take it?
Okay, in that case, there is a risk of bleeding, since we will be taking some tissue samples. So you will have to stop this drug, aspirin, 7 days before the procedure, but you can start immediately after the procedure is over.
Okay, so could you please tell me that how long it will take to get me the results of this? You are saying the tissue sample.
Okay, this will take at least 2 weeks, and after 2 weeks, you will get your report, and you will visit the outpatient clinic to discuss about the findings of your investigations. So, do you
Okay.
have any more questions?
Yes, doctor. Could you
Okay.
please tell me that what about my smoking and I'm actually sometimes I drink socially.
Okay.
So do
Okay.
you have any avoidance there?
Yes, after the procedure is done, you need to avoid taking any alcohol or smoking. You need to avoid that. Okay, and
Okay.
one more thing I would like to tell you, that after the procedure is done, we would want you should bring someone along with you, because to drive you back home, because you will be drowsy and you won't be able to go alone on your own. So
But
it will
doctor,
be
I
better
live
if you
alone.
bring
I have
someone.
no one.
Okay, in that case, we can arrange someone for you. Arrange someone for you from the hospital.
Arrange the
So,
taxi.
do you understand what I told you so far?
Yes, doctor. Yes.
Okay. So, if you have understood, can you sign this consent form
Okay.
for me?
Yes.
Okay. And do you want me to repeat the whole thing to you again?
Yes, if you may.
Okay. So I have told you that we are going to do this procedure, colonoscopy on you, and I have told you all the procedures, and you will be sedated, and also will be given with laxatives, and this will be done by our consultant, and there are some risks. I have told you about that as well, and what food habit and what medications you will be taking, and what medication you will be not taking before the procedure, I have explained you well. So, and you have understood, and you have understood all of it.
And
Okay.
agreed to give your consent.
And you have also given your consent.
Good. Very good. Okay. Thank you. Both of
Thank you,
you.
ma'am.
Thank you.